Herpes zoster ophthalmicus. Definition: Herpes zoster ophthalmicus (HZO) is a viral infection caused by the reactivation of the varicella zoster virus, the same virus that causes chickenpox, in the ophthalmic branch of the trigeminal nerve. It primarily affects the eye and surrounding areas. Etiology: HZO is caused by the reactivation of the varicella zoster virus, which remains dormant in sensory ganglia after a previous chickenpox infection. Clinical features: severe eye pain, rash and blisters on the forehead, eyelids, and around the eye, redness and swelling of the eyelids, sensitivity to light, blurred vision, possible corneal involvement, leading to vision loss if left untreated. Risk factors: age, as it is more common in older adults. Weakened immune system, stress, previous history of chickenpox, sequelae. If not promptly treated, HZO can lead to complications such as corneal scarring, glaucoma, and even blindness. Investigations: diagnosis is often based on clinical symptoms and examination by an ophthalmologist. Viral culture or PCR testing of the affected tissue can confirm the presence of the varicella zoster virus. Treatment: antiviral medications, such as acyclovir or valacyclovir, to reduce viral replication. Topical corticosteroids to manage inflammation. Lubricating eye drops to relieve dryness. Pain management with analgesics. If corneal involvement is severe, surgical intervention may be necessary. Management: patients with HZO should be closely monitored by an ophthalmologist, as early intervention is critical to prevent complications. Regular eye examinations are essential to assess for corneal involvement. Prevention and precaution: the herpes zoster vaccine is recommended for adults over 50 to reduce the risk of shingles and its complications, including HZO. Prompt antiviral treatment during the acute phase can reduce the severity and duration of the infection. Patients with HZO should avoid close contact with individuals who have not had chickenpox or the chickenpox vaccine. Summary or more points: Herpes zoster ophthalmicus, HZO, also known as ophthalmic shingles, is a viral infection caused by the reactivation of the varicella zoster virus, VZV, the virus responsible for chickenpox. When VZV reactivates, it can cause a painful rash and other symptoms along the ophthalmic branch of the trigeminal nerve, which affects the eye, forehead, and surrounding areas. Pathogenesis and etiology: HZO occurs when the VZV, which initially causes chickenpox, varicella, becomes dormant in the sensory nerve ganglia, typically in the dorsal root ganglia. Reactivation of the virus can occur later in life, leading to HZO. The exact trigger for reactivation not clear but can be associated with age, immunosuppression, or other underlying health conditions. The virus travels down the trigeminal nerve and affects the ophthalmic branch, leading to symptoms in the eye, forehead and surrounding areas. Signs and symptoms: initial symptoms often include pain, burning or itching in the eye and surrounding areas. Within a few days, a painful rash typically appears on one side of the face, along the distribution of the ophthalmic branch of the trigeminal nerve. The rash consists of grouped vesicles, blisters, on an erythematous, red base. Other common symptoms include photophobia, tearing and blurred vision. The rash and other symptoms can be quite painful and may last for several weeks. Risk factors: HZO is more common in older adults, especially those over the age of 50. Individuals with compromised immune systems, such as those with HIV, AIDS, cancer, or on immunosuppressive medications, are at higher risk. Having had chickenpox in the past is a prerequisite for developing HZO. Stress and underlying medical conditions may also increase the risk of reactivation. Complication: corneal involvement, such as ulceration or scarring, which can affect vision. Secondary bacterial infections of the skin or eye. Postherpetic neuralgia, a severe and persistent pain that can persist even after the rash has resolved. Vision loss if the eye is severely affected. Diagnosis: based on the characteristic rash and symptoms, viral culture or PCR testing, samples taken from the rash or eye. Treatment: antiviral medications, acyclovir, valacyclovir or famciclovir. Pain relievers are also used to manage the pain.